We'll be discussing the principles of diagnosis of neurological illness, how to localize a lesion, and how to find out the nature of the lesion, the nature of the pathology, and finally to combine the two and come to a diagnosis or a differential diagnosis and the other information useful in caring for patient with neurological problem. Neurological diagnosis is slightly different from the diagnosis of other illnesses. In neurological diagnosis, we try to find out where the lesion is, what is the site of the lesion, and then we try to find out what the nature of the pathology is, whether it's inflammation, infection, and so forth. And when you combine the two, we get the diagnosis. For example, if the lesion is in the hemisphere or internal capsule, and if it's very sudden onset, the likely pathologies would be either a traumatic lesion or a vascular lesion like a stroke. So, when you combine the two, we come to a diagnosis of hemispheric stroke. Now we find out how the site of the lesion can be found. That is to answer the question where the lesion is. It is mainly by neurological examination. However, history also helps in many instances. For example, if the patient says, I have a weakness on the left face, arm, and leg, the lesion should be on the right hemisphere. Different sites of the nervous system will give different patterns of weakness and disability. Therefore, it is very important to examine the patient completely with the correct technique and in correct order. Then you'll automatically find the correct physical signs. Pattern of physical sign or disability will be the same for a given site of the lesion. We'll take this example of a Broca's aphasia. Whatever happens to the Broca's area, the end result would be aphasia, expressive aphasia, be it traumatic lesion, vascular lesion like a hemorrhage or infarct, or degenerative lesions, or congenital abnormality. Whatever happens to the Broca's area, the patient will be unable to speak, so he will be aphasic. So, if we find out the pattern of the lesion, and you can then work out where the problem be. How do we find out what the pathology is? This is mainly from the history of onset. As you know, if the patient says this is there from birth, we know it's a congenital problem. On the other hand, if the patient said, no, this occurred few days ago, but it came very suddenly, then it is very likely to be either traumatic lesion or a vascular lesion. Similarly, the others can be worked out. Now, by what is important is not the duration of the illness. What is important is the duration of onset. Duration of onset is the time taken for the first symptom to appear and for its maximum disability to occur. That is the duration of onset. Then, of course, you tell about the progression, whether it's end up in death, deteriorated, or whether it get better. But the most important thing to find out the pathology is the duration of onset. And so, if the If you have a left hemiparesis, meaning a right hemispheric lesion, we will see how the nature of the lesion can be found. If it has occurred within minutes or maybe within hours, then the diagnosis would be either something like a vascular obstruction or hemorrhage, which is called a stroke, or a traumatic lesion causing a damage to the hemisphere. If it occurs within few days with fever, it is very likely to be an infection, something like a cerebral abscess or meningitis. If it occurs over a few weeks, it is more likely to be a chronic infection like tuberculosis or subdural hemorrhage. If it is occurring over a few months, it can be a rapidly growing tumor. Over several months or few years, a slow growing tumor may cause symptoms. But if the disability is slowly progressing over many years, it is very likely to be an adult neurodegenerative disorder. And in the CNS, there is another type of pathology which is called a demyelination. This is also like a acute infection if you get one attack. So they have a disability developing over a few days and then come to a plateau. However, this disability will improve over a few weeks or months, and then he may develop a disorder at another place in the nervous system. Overall disability will progress if they get more frequent and several attacks. This is called demyelination, or actually the pathology and the story of a multiple sclerosis.